I have had the privilege of serving on the Public Health Committee, and I want to thank the leaders and members of that committee for bringing this bill before us. I've also had the privilege to serve as a member of the Board of Directors of a regional hospice in Western Connecticut for about 6 years, and learned a lot about what hospice care really is and all that it is, and also the tremendous need that there is for people at that stage in their lives, along with their families. There has been tremendous focus on ensuring that every single aspect of this bill would emphasize and strengthen the regulatory environment for the provision of hospice care in inpatient facilities. It's also important for everyone to realize that we all think of hospice care as pertaining to cancer patients in the last period of their life. They serve many others. It's not only people that are diagnosed with cancer. It is many other people, which includes children, when they're diagnosed with terminal illness, and they receive the palliative care that is based on a national model when they need it the most and when their families need it the most. From being involved in our regional hospice, I've had the experience of becoming aware, for instance, of a 14-year-old cancer victim in the final weeks of their life having to be admitted to a nursing home next to a patient who had had a hip replacement because there was no other adequate facility to put that individual in, and they couldn't leave this dying 14-year-old at home side by side with their sibling under those circumstances. And I think that from looking at all of the information that's been brought forward, keep in mind that we had a very extensive regulations review public hearing that was sponsored by the Department of Public Health. I attended it. There were several hundred people there. Great interest in what this legislation and what these regulatory changes does. And I think I can say from firsthand experience that people listened intently and considered the thoughts and concerns that people voiced. The same type of thing happened when we had the public hearing in public health, a hearing that went on for, as I recall, about 7 hours, maybe more. There were nearly 100 people that spoke on this bill by itself. And we learned a lot through that process. And I observed that we all listened intently and carefully considered the thoughts and experiences that people shared with us. I think the department came forward with these regulatory changes over a year ago, and during that 13-month period, there's been extensive and very thorough discussion and evaluation to ensure that when these regulatory changes are brought before us for the first time in about 35 years, that they be not only adequate, but be as best as they can be to have clear and appropriate oversight of the care that's provided in these circumstances for the people most in need. And certainly there are organizations within the state of Connecticut that are prepared to respond to these changes and expand and enhance the level of opportunity for this important and specialized area of care to the people most in need. And I'm very convinced that that's exactly what this language will do and provide. And I urge the support of the entire membership. This bill comes before us with 54 co-sponsors on it, which demonstrates a broad and sound level of support for the people that we all serve. Thank you.